Next, we have Dr. Neda Ahmadi. Here? Yes. Relation between extended screen time and axial length, a prospective study.
Should I start? Good afternoon. Myself, Dr. Neda Ahmadi, and I'll be presenting on the topic relation between extended screen time and axial length, a prospective study. There's no financial interest. The development of myopia is influenced by both genetic and environmental risk factors. The usual progression in myopes between 6 to 11 years is approximately 1 diopter per year with 0.03 mm per year axial length elongation, and between 12 to 16 years it is approximately half diopter per year with 0.17 mm yearly axial length elongation. The adoption of digital smart devices constitute a new form of near work wherein children spend prolonged, uninterrupted period of time with closer viewing distance than the conventional books. This has tremendously increased during COVID-19 pandemic. Thus, we aim to study the effect of digital screen devices on progression of myopia and evaluate the changes in the axial length with the myopic shift. It was a prospective observational study conducted between September 2020 to February 2022. All the school-going children with physiological myopia between the age group of 5 to 18 were included, and children with amblyopia, strabismus, pathological myopia, retinal and congenital disorders, etc. were excluded. A total of 196 children were taken up after satisfying the criteria. Data was collected through a structured questionnaire, and average daily time spent using devices were quantified by self-reported estimates. A comprehensive ophthalmic examination, including cycloplegic refraction and axial length measurement, was done, and patients were followed up after 6 months. Coming to the results and discussion, there was no significant difference in age and sex distribution, and the mean age was 11 years. The most common type of devices used were of handheld types as they were more convenient. The mean screen time was about 6 hours, which can be attributed to online education system and increased recreational activities during lockdown. Similarly, Mary et al. Showed that mobile exposure of more than 4 hours per day, and Hansen showed that more than 6 hours per day were significantly associated with progression. In our study, it was found that out of total 196 children, 172 had progression of myopia. Among these 172 with myopic shift, it was beyond physiological limit in 127, with maximum being axial type of myopia. The mean screen time was 6.45 hours. The mean change in spherical equivalent was minus 0.87 diopter, and the two showed a positive correlation with the R value of 0.58. Also, Foreman J et al. Showed that more the duration of screen time, more will be the myopic progression. The mean change in axial length was 0.25 mm. A positive correlation was found between change in axial length with the myopic shift with the R value of 0.94, which was consistent with the finding of Zhang X et al. So, I would like to conclude that excessive usage of digital smart devices during pandemic has accelerated the rate of progression of myopia, with axial elongation being the major component. Thus, digital screen time can be regarded as a modifiable risk factor, which can prevent the anticipated myopic epidemic by the year 2050. Moreover, axial length measurements can be used to predict the onset of myopia, monitor the progression, determine the risk of associated pathologies, and evaluate the effectiveness of myopia management. Hence, regular screening must be done at every 6 to 12 months, not only with cycloplegic refraction, but also with axial length measurements. It is recommended to limit the screen time to 2 hours per day and follow some preventive measures like use of laptops over handheld devices, following 20-20-20 rule, and encouraging outdoor time of at least 2 hours per day. Lastly, and most important, is to create public awareness regarding the effect of indoor near activities and reduced outdoor time on incidence and progression of myopia. Thank you.
Thank you. Is it 2 hours per day a lot of screen time every day? I mean, generally,
Yes,
I don't think we recommend that. On weekends, we would allow them maybe an hour and a half of screen time. But every day, I feel half an hour should be more than enough.
Ma'am, according to American Academy of Child and Pediatric, Child and Adolescent Psychiatry, they have recommended the screen time according to the age. Like between 5 to 18 years, they have recommended like about maximum 2 hours per day. And below that, below 5 years, they have recommended up to 1 hour. Below 2 years, that is between 18 months to 24 months, they have recommended less than 1 hour, and below 18 months, they have recommended no screen time, absolutely no.
See, this is American Academy.
Ji, ji.
We are talking about Indian conditions.
Yes, ma'am.
So, in America, they don't have neighboring children to play with. Here we do. So, I think we need to find out the ideal amount of time for Indian standards. That's not part of your study, I agree. But I still feel 2 hours a day is a bit much.
Yes, ma'am. Ministry of Education has recommended some guidelines for educational screen time. Like they have recommended to reduce it to 30% of total educational time. The online education which is given, it should be less than 20 per day, and less than 20 minutes per day. Then in between the educational time, they have recommended to give 10 minutes of break after every 40 to 45 minutes, which is more feasible than following a 20-20-20 rule. And along with that, they have also recommended to limit the online video games by creating an age limit and also limiting the time. And then apart.
I just want to know, you said 2 hours.
Yes,
In
sir.
your data, did you actually have children who were actually seeing less than 2 hours and their myopia did not progress? Do you
No,
have
sir,
it in your data?
Sir, actually having a
Ah.
control group is very good for the study, but my study was conducted during COVID time. So at that time, finding a control with less screen time was
Yeah,
not possible,
that's
sir.
right.
Okay.
And your the age group was from 8 to
5 to
18.
18.
5
5
to
to
18.
18. Yes, sir.
How many of the age group, say beyond 15 or 14, they had the increase of myopia, which was corroborated with increase of axial length? Because after some time, it is not still known why myopia progresses, but the axial length remains same. So have you got the data that beyond 15 years old age children, how much it matched with their axial length progression? The myopia progression was matched with their axial length
Yes, sir.
progression?
The relation between axial length and the amount of myopia is not very linear, and it is not very constant. But the matching, I mean, more linear is found in older children as compared to younger children, because in younger children, the axial length progresses more as compared to amount of myopia.
Okay, thank you.
Thank you, sir.